Welcome all. I'm doing this video today because next week, next Wednesday in fact, is the 70th anniversary of the NHS, and I just thought it was a really good opportunity for us to take a moment to reflect, to look forward, and to celebrate everything that has been achieved. It certainly made me reflect. And to tot up the years, in fact. So I worked out that it is 38 years ago that I first worked in the NHS as a ward orderly in Whipps Cross Hospital, learning how to mop floors and do washing up at an industrial scale. It's 35 years ago that I started working on the wards as a clinical medical student at the London Hospital in Whitechapel. And in 1987, it's about 31 years ago, I first came to the Maudsley Hospital as a registrar. So for 31 years I've been working in mental health, and an enormous amount has changed in those 31 years. But if you stretch that back over the last 70 years, what the NHS has achieved over that time is absolutely amazing in terms of the health of the population in the UK, and in terms of life expectancy and access to life-saving treatments for diseases that before then were absolute killers. So it has been a remarkable institution, and one that is well worth celebrating. If you think about what's happened in mental health over that 70 years, also the changes are staggering. So the NHS was founded in an era when mental health care was largely delivered in institutional settings, pre our first antipsychotics and pre our first effective antidepressant medications, and even over the last 2.5 decades we've witnessed the deinstitutionalization of mental health care, with the move away from asylums and into the community. And in many respects, I think within the NHS, we've been at the vanguard of that movement, and people are now seriously looking at the lessons to be learned from what mental health has achieved over these last 2.5 decades. Hasn't all been straightforward. I think we all know that. I think we know that our move into the community was bumpy and at times difficult, but I certainly now feel enormously proud of the teams that we have working with people outside of hospital settings and in people's homes. We've also now had 10 years of austerity, and I didn't think it was right to do this video and for it to be all upbeat. We know the last 10 years in the NHS have been hard, where we have had to continue to deliver services with relatively flat funding and with ever-increasing demand from our local communities. And in particular, I know that the jobs that you do every day are difficult, so thank you for that. And they are challenging, and they're particularly challenging, I think, because we all care about the work that we do. But even within those 10 years, some amazing stuff has happened. If you think about where mental health is now in the public domain, we have never had so much profile and coverage around mental health issues. We've never had so much focus on stigma. We've never had so much focus on the right of people with mental health difficulties to expect the same quality of care that they should and would expect if they had a physical health difficulty. We've transformed the context for mental health in this country. Every single political party now has mental health as one of its priority agendas, so I think we should feel very proud. We've also continued to transform the treatments and interventions that are available for people, from eating disorders for children and young people through to novel treatments for psychosis and depression. So an amazing amount is happening. Having said all of that, I think it only continues to happen because of something that I learnt recently they call discretionary effort in the trade. What discretionary effort is the fact that you and I are all prepared to devote 110% of our time and effort to the NHS and to the people that we work with in our daily jobs, because we care about the principles of the NHS, we care about access to high quality healthcare that remains free at the point of delivery, and we care about individual people. So that discretionary effort is, I think, really what makes the NHS continue to work. If we all worked just according to our job descriptions, I think we'd be in difficulty pretty quickly. I'm aware that I'm recording this video just a few days before we have a major inspection in this organisation. I've got the CQC coming in next Monday and the week after, so I know all of you will be busy. I didn't want to miss the opportunity, though, to say two things. First of all, thank you for all of your amazing work, all of the things that you do every single day, because you care about the people that you're working with. And secondly, do take an opportunity to celebrate. So I've been given here on my desk a flyer from our comms team. This flyer highlights where the tea parties are going to be over the next week. Make sure that you take a little bit of time out to go and celebrate 70 years of the NHS. Thank you all very much indeed. Bye.